Maybach Media.
Guys, there's a new development in town. So, a man who has been HIV positive in London appears to be free of the virus after stem cell transplant. And this is the second success story, including the Berlin patient doctors once reported on. So, the therapy had an early success with Timothy Ray Brown, a US man treated in Germany who is now 12 years post transplant and still free of HIV. Until now, Brown is the only person thought to have been cured of infection with HIV, the virus that causes AIDS. Such transplants are dangerous and have failed in the past with other patients. They also are impractical to try to cure millions already infected. So there is that. But the latest case shows the cure of Timothy Brown was not a fluke and can be recreated, according to Dr. Keith Jerome of Fred Hutchinson Cancer Research Center in Seattle, who had no role in this new success story. So he added that it could lead to a simpler approach that could be used more widely by more doctors to try and cure HIV. So the case was published online Monday by the journal Nature and will be presented at an HIV conference in Seattle. The patient in this case has not been identified. He was diagnosed with HIV in 2003 and started taking drugs to control the infection in 2012. It's unclear why he waited that long. He developed some disease called Hodgkin lymphoma that year and agreed to a stem cell transplant to treat the cancer in 2016. With the right kind of donor, his doctors figured the London patient might get a bonus beyond treating his cancer, and that was a possible, HIV cure. Doctors found a donor with a gene mutation that confers natural resistance to HIV. About 1% of people descended from Northern European have inherited the mutation from both parents and are immune to most HIV. The donor had this double copy of the mutation. That was an improbable event, said lead researcher Ravindra Gupta of University College London. That's why this has not been observed more frequently. The transplant changed the London patient's immune system, giving him the donor's mutation and HIV resistance. So the patient voluntarily stopped taking HIV drugs to see if the virus would come back, and apparently it never did. So usually HIV patients expect to stay on daily pills for life to suppress the virus. When drugs are stopped, the virus rose back usually in 2 to 3 weeks. That didn't happen with the London patient. There's still no trace of the virus after 18 months of the drugs. Brown said he would like to meet the London patient and would encourage him to go public because it's been very useful for science for giving hope to HIV positive people. To people living with HIV, he told reporters that they should not lose hope, but keep on hoping and believing something will happen soon, which is a good thing to offer to someone who is sick and probably thinking they're going to die at some point. But anyway, stem cell transplant typically are harsh procedures which start with radiation or chemotherapy to damage the body's existing immune system and make room for a new one. There are complications too. Brown had to have a second stem cell transplant when his leukemia returned. Compared to Brown, the London patient had a less punishing form of chemotherapy to get ready for the transplant. Did not have radiation and had only a mild reaction to the transplant. Dr. Giro, the German doctor who treated Brown, called the new case great news and one piece in the HIV cure puzzle. So it seems like very soon a cure for this disease is going to be here, and it will have something to do with stem cells and transplanting them and figuring out how to do it in replicating the treatment for millions in an easy way that doesn't cause complications, and then we have to go back to the drawing board. So let me know what you think on the comments down below. Please leave a like, subscribe to us, share this video, and catch you in the next story. Peace.
Yeah.